and today I'm going to present a work that we developed a few months ago entitled Handheld Robotic Device for Laparoscopic Surgery and Training. This is the presentation outline. I will start by giving you a brief introduction about laparoscopic surgery and the main difficulties and limitations in today's clinical environment. Then I will show you how can we improve this kind of surgeries with a new solution, what we call EndoRobot. And then I will show you the methods to develop this robot and also the results and final remarks that we achieve. So, laparoscopic surgeries are minimal invasive procedures that have revolutionized traditional surgical techniques. In fact, these procedures have been used to treat, manipulate, diagnose, or local therapies in different organs, such kidneys, pancreas, the colon, stomach, among others. In these procedures, surgical tools with small diameters are inserted from the skin through a small incision and then are guided to some anatomical target. This is just an example of one of these surgeries. So, with the technological advance, non-invasive or minimal invasive methods have reduced the need of open surgeries, which are most invasive. These surgeries have carried out some advantages, such small patient incisions, reduce the postoperative pain, and also allows faster recovery to the patient. However, besides its advantage, laparoscopic surgeries have also some shortcomings, since the surgeon manipulates the organ through a small incision and they don't have an open view of the target, the anatomical target. He have difficult on handling the surgical instruments, also restricted mobility inside the human body, that needing high dexterity and eye coordination. And most of the times the surgical instruments are inadequate and non-ergonomic. So the surgeon must know intraoperatively and in real time which will be the next move to perform, to cut, to turn the instrument left, right, and also have a mental map of the 3D organs of the patient. Moreover, most of the times, as the invasiveness decreases, the surgical instruments becomes more complex and also expensive. Due to these shortcomings, several authors have also already proposed some robotic devices over the literature. Although these new devices can improve the precision and accuracy of the surgeon, allow scalable movements, reduce the human tremors, they are also expensive and need high training hours. So, the ideal solution is to develop a device, a robotic device that is low cost, as the most basic surgical tools, and also intuitive to use without further training hours. So, in this presentation, I'm going to present the EndoRobot, that is a portable robotic handheld surgical instrument with 6 degrees of freedom. The first 3 degrees of freedom are controlled by the surgeon, and the other one the surgeon can control with a joystick and also a trigger. The prerequisites of this robotic handheld was to develop electromechanical control of the a disposable tool to be used in different surgical procedures with different levels of velocity, and also allows to redefine movements to facilitate the execution of common surgical tasks as suturing, cutting, grasping, among others, and also a simple replacement of the disposable tools with the different tips, and also to support offline surgical simulation. So the electromechanical system of the EndoRobot was developed with a set of mechanisms with servo motors, batteries, joysticks, display, in order to activate and control the 3 axes of the disposable tool, and also to attach and support the tool to be used in surgery. So, in order to attach the tool to the EndoRobot body, we developed a plug-and-play system that is based on a servo motor, here as purple, that works as a lever that moves down or up 2 pins that locks or unlocks the tool. Regarding the other 3 degrees of freedom, considering the rotation, it is also based on a mechanical transmission system that we have a servo motor and straight spur gears that allows to rotate the tool after locking to the EndoRobot body. To open the gripper, we use a trigger system that gives force feedback to the surgeon, and it is based on a lever movement of assistant jaws that creates a compression or attraction of 2 wires, two metal wires that control the opening and closing of the 2 forceps of that tool. Considering the translation, it is similar as the rotation. We use also a pair of straight spur gears, and we have also a spindle that converts the rotation in a linear movement. Okay. So now we already know how to control all the 6 degrees of freedom. We can control the first, second, and third one. It's manually by the surgeon. The other 3 are also by the surgeon, but using a joystick to move down or left that controls the servo motors that allows to rotate or translate the disposable tool. And he also has the trigger to open or close the forceps. But if we want to use this robot as a surgical training, we have to track all the inertial movements in real time. For that, we use an IMU, an inertial measurement unit, to track the first 3 rotations, the first 3 degrees of freedom. This IMU with 10 degrees of freedom have a gyroscope, accelerometer, magnetometer, and altimeter, and the information of these 3 sensors are combined to create a cosine matrix that gives the information about the call pitch yaw to update a virtual model in the computer. Considering the other movements of the disposable tool to rotate or to translate, since we are using servo motors based on the rotation of the motor, we use an encoder that captures the number of rotations of the servo motor. For that, we put an absolute magnet in the servo. track the trigger, we use a magnet strip element that tracks this transmission bar to the jaws when we move the trigger to the left or to the right. We can track which position after a certain calibration where the degree of opening or closing. All the data from the different encoders and also from the IMO are processed in the microcontroller embedded in the EndoRobot and then is sent via wireless to a computer for surgical training. So, after developing this EndoRobot, the testing was twofold: a technical test in the laboratory and also a user evaluation. For the technical test, the EndoRobot was tested in a low-cost laparoscopic simulator and a training game. For the training game, he used a wire chaser game that are already used for surgeons to train the hand-eye coordination. So, in this game, in this simple game, the user only has to move the ring along to a wire path. That is, this wire path is defined according to different surgical procedures, the different movements that the surgeon has to do during surgery. We also characterize technical specifications of the EndoRobot. We have an autonomy of 4 hours and we can update our virtual model 20 frames per second that we can update in real time. The weight is a little heavy, but we are also designing a new EndoRobot more ergonomically, and we test with the two velocities the rotation of the disposable tool with 2.3 seconds of a full rotation and also 3.6 that are similar as the surgeons use during a common procedure. We also study this EndoRobot in a group of 26 participants in the Life and Health Science Research Institute. You use a group of 15 people in the naive group. This is a group with people that have no experience. Most of them were medical students. And also in an expert group with 11 people that were surgeons that already performed more than 50 laparoscopics. And all tasks were carried out with a standard laparoscopic training course. So each participant has to do 3 tasks. The back transfer, he had to transfer with the EndoRobot this wood piece from one side to another. The wire chaser, they have to move 3 rings with different diameters from one side to the other, and they have to make a knot of an artificial arterial system. This is the results of this user evaluation. The EndoRobot can improve the execution time to make a knot. That is one of the most difficult tasks during surgery. This is the table. However, we have a lot, the standard deviation are too high because of the group was also small, but there are a lot of variability between surgeons, even if they are experts. And for the task of the back transfer, the EndoRobot results were worse than with a classic tool, maybe because of weight of our system. So, as conclusion, the EndoRobot shows that it can facilitate the maneuvering of the surgical tools, mainly to make a knot. It can improve the positioning, accuracy, and also the precision. It may improve the efficacy of the surgeon. It can be used as a realistic simulator. Can also now develop new games to test other surgeon skills. And it may broad use of laparoscopic surgeries to surgeons less familiar with minimal invasive procedures. The size of the weight must be reduced in our solution and maybe in future work. I'd like to thank the institution and center that I'm with. I'm also working in this group. You can search more information in research.com. Thank you.